Good morning, and thank you for joining us for SBB Live. This is Amanda Barton, your host and the publisher of Seniors Blue Book. Really excited today to bring on a special guest, Miss Sharon Murphy, who is the founder and a nurse and the CEO of the McGregor Clinic. How are you this morning?
I'm great. Thank you. How are you?
Really good. Thanks, Sharon. Talk to me a little bit about yourself. What led you to create this wonderful organization and all that it does for Lee County as we are celebrating World AIDS Awareness Day?
Well,
Or North, I should say.
uh, over 20 years ago, I worked at the health department at what was then the McGregor Clinic, Lee County Health Department, McGregor Clinic. We had stepped in to provide care there. We were then located on McGregor, and it was run by the health department. And the health department decided that they were phasing out of primary care and delegating to other agencies, and including McGregor Clinic. And the clients came to me and said, isn't there a way we can keep this clinic open? And I said, sure, I'm sure there's a way. And so 3 of us met in the parking lot of the clinic and decided that we would move ahead and try and find a way to keep it open. And we contacted the governor's office, then Governor Lawton Childs, and asked for an opportunity to be heard and present our case to keep this clinic open. And he sent staff down. We had a public meeting, and the community turned out. There were about 200 people there, which was impressive. They were family members, friends, caregivers, and clients, and asked for a chance to start their own clinic. And over the next year and a half, we partnered with staff from Lee Memorial, Family Health Centers, and also FGCU, their public health, School of Public Health Department, Dr. Wimberly, and we put together a nonprofit organization, and we opened our doors November 15th of 1999.
Wow. Now, for those that don't know about your organization, you want to talk to us about exactly what the McGregor Clinic does and some of the services that you provide as a nonprofit?
Okay. We provide primary care for people living with HIV. And in the early days, we were seeing people briefly because it was a death sentence at the time in the 90s. And then as treatment progressed, people were doing very well with HIV, but having issues with diabetes, high blood pressure, so on. And so the focus then became on managing all chronic illnesses for our clients. So we do primary care for people living with HIV. We also provide community education and testing to identify those people in the community that may need our services, and also provide education so that if you test negative, you stay negative. So we also provide case management services. Many of our clients don't have insurance. They need to access treatment through the Ryan White Care Act. With the ACA, we have case managers who help clients enroll in ACA so they can get health insurance. And we also have a food pantry and a clothes closet. So clients can come in, see their doctor, see their case manager, get some food, stop at the clothes closet, and it's a one-stop shop for all the services that they need.
It's just an amazing service that you provide. And I want to touch briefly on you kind of hit a subject that that a lot of people are talking about it these days. It's not a death sentence anymore. Talk to us about some of the advancements in medicine, not only for people that are living with HIV, but to protect those that may have a loved one or spouse that they want to continue living a normal life with.
Right, exactly. The medications in the early days were very challenging to take. Initially, it was medication every 4 hours around the clock. So I'm sure you can imagine that that was not easy to stay on those meds. And then as treatments failed and medications did fail, we would have to change the regimen. And sometimes they were on 25, 30 pills a day, taking them 3, 4 times a day with food, without food. It was really challenging to stay in treatment. And research has come a long way. Someone can be well maintained on a medication, 1 pill a day, where all 3 drugs that are required to control the virus are in 1 pill. So it's a 1 pill a day, and you take your medication every day. You can't transmit HIV. Your viral load stays undetectable. So you can no longer transmit HIV to your partner. Now, we also have PrEP. So we have prevention medication that someone who is concerned about contracting HIV, they're HIV negative, they want to stay that way, they're practicing safe sex, doing all those things, but they want to make sure that they stay negative. We have 2 medications now, depending on their risk factor and gender, because some are specific to men and not recommended for women. But we have medications that it's again 1 pill a day, and you follow with your physician, you get tested regularly, and you can stay negative. So we've come so far in prevention and so far in treatment that this is now a chronic manageable illness like high blood pressure, diabetes. You need to, live a healthy lifestyle. For many of us, that's a challenge, whether we're living with HIV or not. That those golden arches are, a siren's call. But you live a healthy lifestyle. You take your medication every day, and you're going to live a long and healthy life, the same as someone who is HIV negative.
Yeah, I've been seeing commercials for this stuff
Mm-hmm.
when I stream. So it's been really interesting that our interview is going to be happening today. I was excited to ask you some of these things. And I have one hard question for you.
Okay.
This disease has affected the entire world. Is,
Yes.
a country like Africa or wherever else it's run rampant, do they have access to this kind of medication?
They do, but it's often an entire day's drive from the village to the treatment center.
Okay.
That has improved now again with 1 pill a day and setting up satellite clinics. And President Bush's PEPFAR movement, which was a global initiative for prevention and education and treatment for HIV, has met all of its goals. They've come a long way and reduced the infection rate, not down to 0 where we would like it, but they've improved access to treatment. And now that treatment, many of the pills had to be refrigerated, which is, if you live in a rural area and you don't have access to that, the first 2 pills are okay, but the rest of the bottle is going to be one solid mess. Okay. So now that we have pills that are much easier to take, easier to transport, they can be shipped, then treatment options have improved.
That's fantastic.
Mhm.
It's amazing how far we have come in this particular discussion.
Yes.
Just amazing.
Yes.
Employ you for all of your efforts and everything that you're doing in the community. And education is so important. It's
Yes.
key. So what you're doing out there, and thank God for you, continuing to keep those doors open and push through, many years ago, as you were stating, when they were going to be taking that away from you. So
Yes.
God bless you for that.
Well, thank you. And I work with an amazing crew. Everybody that's here, this is truly their heart's work. And the clients feel it when they come in the door. They know that they're being taken care of by family. And for many of our clients, we're the only ones that know their HIV status. And so they come in here, it's a place of comfort. They know that they're going to get the services that they need, and they're going to be treated with the compassion and dignity that they deserve.
Absolutely. Well, Sharon, it's been just such a pleasure getting to know you and continue to do your good work. And I just appreciate you so much spending the morning with me.
Well, thank you. We appreciate the opportunity to get the word out.